Hey guys. So I made it back from my trip out west. If you follow our Facebook or Instagram, then you saw that I was out in BC for a week and I'm back from that and hit the ground running. But today I want to talk a little bit about our goat Linus. So if you follow us on Facebook or Instagram, you would have saw on Tuesday that I was taking Linus to the vet. So I've been actually trying to make a video since then, but I just haven't had a second to really film. So while I was away, Michael noticed like a lump on Linus's neck. And at first he thought maybe it was a milk goiter, which is a really benign condition that can happen to lambs and goat kids as they are developing their immune system and their thyroid gland swells up. And so it can cause what's called a milk goiter. It's no big deal. Ladybug are one of our original lambs, actually the first lamb that was ever born here. She had one. So I already knew about those. But when I got home and I looked at it, I realized it wasn't midline. So a milk goiter will be right in the center of their neck. And sorry, I keep moving around, but the bugs are getting me. This was a bad idea to come outside to film. So the milk goiter will be right in the middle, and this one was off to the side. So I looked at it and thought, well, I started Googling things, but of course you come across a lot of worst case scenarios. But the one thing we were concerned that it was going to be is a condition called, I'm going to have to read it because I'm not very good at saying it. Caseous lymphadenitis. 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 Anyway, it's called CL in the goat world. So, and it's kind of, it's like an uncurable bacterial infection, basically. So once a goat has it, they carry it forever and they might develop these abscesses once and then never again. They might develop them repeatedly. Sometimes, more rarely, it can become internal. So they'll get them like inside their bodies or whatever, like on their lungs, and for females, like on their udders, in their udders. So unfortunately, in that situation, like if it is CL, a lot of times what's considered best practice is to cull the goat. And so we talked about that because we were like, well, it could be CL, like maybe we should just call him right away. But he's so sweet and we've never had a case of it before. Like, so CL can live on surfaces and in your soil for, I mean, they say up to a year. Like it can be, it's super contagious, like extremely contagious when the abscess opens and then there's pus and stuff coming out of it. That fluid, like if it gets on any surfaces that can't be sterilized or on the ground, then it can remain and it can live and infect other goats and sheep for like up to a year. So obviously that's really scary. All of our adult ewes are vaccinated. So we vaccinate our sheep with Glandvac 6, and that's one of the things that it covers. So the adult ewes are all vaccinated, so I'm not super worried about them, but all of our lambs are not. So we don't do the first dose of Glandvac 6 until everybody's 6 weeks of age because of a study that came out of the University of Michigan, I think, about a year ago, that says it's not very effective if you vaccinate them before 6 weeks of age. So 12 of our lambs have been vaccinated, like were vaccinated before I left on my trip, but the rest haven't been. So, I mean, we have to be concerned about them as well. We decided that either way, like we need to know what we're dealing with, because it's also possible that he got like a bite or like poked by something, or like as goats are eating like sharp, like thorny shrubs and stuff, they can get like little like micro, I don't know, like sores, like not like they can injure the insides of their mouths, right? Like as their mouths are, especially when they're little. So he could have got like a little sliver like in his mouth that then, created this infection, like, because it's kind of on the side of his jaw and like neck. So it could have been something he ate. Like, it could be other things. It might not be CL. And if it is CL, we need to know what we're dealing with. So because he's been living with Obatanga in the barn. So the good news is that he hasn't been really outside of the barn very much, hardly at all. Like, we kind of let them out into like a green space in the day, but right now that space is occupied by pigs, and pigs are not susceptible. So they have been away from the rest of the flock basically their entire lives. So that's beneficial because they haven't been exposed to everybody else. But Obatanga has to now be isolated until we know for sure what we're dealing with. So, and they have to be separated from each other because she might not, like, we just, now that he's got, okay, so I'm getting ahead of myself. So I took him to the vet on Tuesday. There's a really good goat vet in Kingston. So I took him in, and she looked at it, and they did open the abscess and like drain it and clean it out really good, and gave him a shot of antibiotics. So with CL, antibiotics don't work because the way that the bacteria works, it causes like the goat's body to like encapsulate the infection so that antibiotics actually can't get to it. But either way, she gave him antibiotics just in case it's not that. Like, it could be staph, it could be, myriad of other things. It's just the location of the abscess that makes it suspect for CL. So she cleaned it out good. She gave him a shot of antibiotics, some pain control and everything like that. And then she came out and talked to me, and she's like, I don't know for sure if it's CL. She's like, I can't say for sure if it is or not. We can do a blood test. It'll take 5 business days to get the results. So I said, yes, let's do it. So she drew the blood. That was Tuesday. So I'm anticipating we should hear back on Monday or Tuesday. She's like, in the meantime, keep him away from everybody. Like, keep him off the ground, like away from your soil as much as you can. Oh dear, somebody honked and stirred up the dogs. Anyway, so that was her advice. And I'm like, oh gosh, like, he's too big to be in the house really. But we do what we got to do. So, so because when I brought him home, the abscess had been opened and now was actively weeping fluids, I didn't want to put him back in with Obatanga because that just increases her chances of exposure. So if it is CL, we will keep her isolated for 2 months. Usually by that time, if they haven't developed any kind of signs or symptoms, they're like most, I wouldn't say they're clear officially, but most producers, like most farm people, consider them clear. So I don't want, like, if she hasn't contracted it, like if it is CL, and because his abscess wasn't open when they were living together, the chances that she actually caught it from him are like almost zero. Except we don't know where he caught it from. This is the big thing, because we've never had a case of it on the farm. We've never had any animals that have any symptoms. Like I said, we vaccinate everybody. Everybody we've brought onto the farm has been vaccinated. So it's hard to say where exactly it came from. But it's also possible that Marcia, his mother, when she cut her leg, contracted some kind of bacterial infection in the leg, even though the wound looked really good. It could have like gone into her blood or whatever, and so he could have actually been exposed to an infection through her, like through her milk, because he was with her for 3 days, and exposure to her leg because it was right by where he would nurse. So it's possible actually that he picked up an infection from her because he's still, like, he's only 2 months old. So that's the other thing, is like CL grows super slowly typically. So that was one of the reasons why we were like, well, maybe it's not that, because usually the CL abscesses like grow more slowly over time. And this one came up pretty rapidly, especially because we look at him like every day, multiple times a day, because he gets bottle fed. So it's not like it could, he could be out in the field and we just didn't notice. So yes, we will find out Monday or Tuesday if it's CL. And if it is, like, our first obligation is to all of the other animals on the farm. And because it's something he'll carry forever, I can't keep him here. Like, we just can't. And so I did tell the vet, I was honest with the vet, and I was like, well, like, we would call him probably. And she was like, there are people who would take a CL positive goat, like knowingly take a CL positive goat. So she's like, don't don't just call him right away because he is so sweet. Like all of the vets and the techs in the office were like totally in love with him because he's so sweet. Like he's just a super loving little guy. And all the attention he's getting now is definitely increasing that. So she was like, just there's people that will take them. Like there's people that will take a CL positive goat knowingly. So she's like, you don't have to destroy him if you don't want to. So we're keeping that in mind because I would love for him to go like have a good life somewhere with somebody who will, take care of him and is willing to deal with that. We just can't because I can't risk all my other lambs and sheep and everything like that. Like it's just not fair. I have to keep all of them in mind as well. So that's where we're at. We're really crossing our fingers that it's not CL, that it's some other kind. Like there's not really other terrible infections that cause abscesses that are like lifelong. And we're taking precautions because actually humans can contract it, but in humans antibiotics work, so it's less problematic, but also not something I want to deal with. So when we're cleaning his, because we want to keep it open and keep it draining, so I've been flushing it. Always wear gloves. We mop everything up with paper towels. We do it in areas where other animals will never be. So it's a lot, but he is very sweet. So I'm really hoping that it's not CL. So that is the update on Linus. And now that I'm home, I will get back into making regular videos. This week has just been really, really busy, but we've got a bunch of lamb sorting and vaccinating and stuff to do. And also, I'm getting a new phone, so the quality of my videos should be significantly better. But it's good to be back. Okay, the mosquitoes are really coming, so I'm going to call it a night, and I will talk to you guys again soon.